The ability to stop someone's heart, restart it, and then not only does the patient live, but they leave the hospital stronger, has to be one of sort of man's greatest achievements. It's like walking on the moon or starting fire.
At what point you thought that I should be a doctor, and in that also a surgeon?
Being a doctor wasn't really a choice. It was more the subject of manipulation. My parents and my grandparents, from the time I was a little kid, they would say, "You're going to be a doctor. You're going to be a doctor." It didn't matter what I said I wanted to be. I had a tragic event in my life. My brother died when I was very young. I was 13 and he was 8. And I remember that moment. And that was sort of the first time in my life that I actually thought I wanted to be one.
We'll definitely get so many things to learn today from you, sir. Hello, everyone. Hi, Dr. X. Hi. How are you?
Very good. Thank you for having me. Appreciate this.
Yes. So this episode, this podcast particularly is called as a Beyond The Whitecoat Podcast. So in this podcast, my aim is to guide people or guide medical students, perhaps, on how they can achieve what they've dreamed of. So considering your amazing career, we'll definitely get so many things to learn today from you, sir. And I hope you're also very keen to guide all the students across the world, actually. All the audience I have throughout my Instagram is mostly from all the different parts of the world, and definitely seeing a cardiothoracic surgeon. Actually, I came across one of your reel where you explained that how vulnerable our life can be. So what things you have to take care of. And I really appreciate your work for the social cause as well as for the patients.
Thank you. One of my passions in addition to heart surgery is helping people change their mindset to learn how to achieve. So I'm excited to talk about those things.
Thank you so much, sir. I hope you are okay with my accent. It's Indian,
Yes.
maybe. Yeah. So perhaps I just, before starting, just to break the ice, I would like to ask you, do you have any Indian co-workers or any residents, Indian residents?
I do. We have many. So I live in Milwaukee, Wisconsin, and we have a large Indian population. And many of my colleagues are from various parts of India. So I do have a lot of experience working with people who are both originally from India, but also who have just their heritage from India.
Yes, sir. Thank you so much for that. Before we start, I would like to ask about your journey, where it all started since your childhood. At what point you thought that I should be a doctor, and in that also a surgeon?
Yeah. So, I think that the decision to be a doctor versus being a surgeon was sort of two different decisions. I joke around that in my family, and it may be like this for a lot of Indian families as well, being a doctor wasn't really a choice. It was more the subject of manipulation. My parents and my grandparents, from the time I was a little kid, they would say, "You're going to be a doctor. You're going to be a doctor." It didn't matter what I said I wanted to be. If I said I wanted to be a rock star, they'd say, "No, you're going to be a doctor." If I said I wanted to be an astronaut, they would say, "You're going to be a doctor." And so I kind of grew up with that mindset. But then I had a tragic event in my life. My brother died when I was very young. I was 13 and he was 8. And I remember that moment. And that was sort of the first time in my life that I actually thought I wanted to be one, because I wanted to help families similar to my own through their own moments of crisis. And so that was when, I was very young when that vision of becoming a physician emerged. I was only 13. And then the decision to be a surgeon was sort of a different one, because I went to medical school actually thinking I would do internal medicine. I was very interested in genetics at the time. The human genome was just being sequenced. And so it was a very exciting time for genetics. But like many people, I was exposed to surgery in one of my first rotations. The surgeon brought me into the heart surgery operating room, and I saw the beating heart for the first time. And I was really captivated. I remember thinking that, the ability to stop someone's heart, restart it, and then not only does the patient live, but they leave the hospital stronger, has to be one of sort of man's greatest achievements. It's like walking on the moon or starting fire. And so I was really hooked and captivated by the heart. And so from that moment, I knew that there would be nothing else that I could do that would compare to being a heart surgeon.
Thank you so much, sir. Your journey is really commendable. I know you have been at the Johns Hopkins School of Medicine. I think you did your PG there as well as your fellowships into the CBTS. So what are your experiences while getting into the match in the John Hopkins?
Yeah. So, well, it was interesting. Into medical school at Johns Hopkins, I got in off the waiting list,
Oh,
and I did well in college, but very, very difficult to get into Johns Hopkins Medical School. I was on the wait list, and what I did was I was persistent, and I wrote letters to the dean, many, many letters saying, "Look, this is my first choice. I really want to come there." Um, and then finally, about a week or 2 weeks before classes were going to start, he called me and he said, "We have a position. Do you want to take it?" And I said, absolutely, I'm in. And then that's what propelled me to Johns Hopkins Medical School, which was a really a life-changing experience. I mean, when you're walking around the halls of Johns Hopkins, you see the history, and all of the halls are named after famous physicians. The rooms, they have such rich history there that I was very intimidated when I first got there. It felt like everybody was so smart and so accomplished, and how was I going to fit in? But I just did what I've always done, which is work hard and try to learn and study. And then I was fortunate enough to be accepted in the match to Johns Hopkins General Surgery Residency, which is the birthplace of modern surgical training. That's where William Halsted, founded the residency program in surgery. And then that was a long and challenging residency. I did 8 years. It was 5 years of clinical, and I did 3 years in the research lab, where I had a master of public health and also did some research on heart surgery and heart transplantation. And then I was accepted to fellowship at Columbia University, which is where I did my cardiac surgery fellowship training.
amazing. Great to know, sir. During your surgery residency, sir, after USMLE preparation, you joined into the surgery residency. At that point, who was your person to look up to, or your idol at that point of time? Because growing up, our idol might be different, but when we entered into the medicine or as a surgery you entered, so whom you would look up to?
Yeah, I agree. I think that there's that saying, when the student is ready, the teacher appears. And I think that when you are at different stages of your life, you have different mentors in each of those stages. And so when I was a resident in general surgery, I would say that there were several people who made an impact on me, but really two in particular that made a profound impact. One was a surgeon named William Baumgartner, who ran the cardiovascular research lab at Johns Hopkins, and he was also the chief of heart surgery at Johns Hopkins. He's also been, the president of the Society of Thoracic Surgeons. He was the chief executive of the American Board of Thoracic Surgery. So he has very good credentials. But despite him being so high powered, he was also just the kindest, nicest gentleman. I remember a time when I was doing research late at night, and they were closing the office, and he let me use his personal office to keep doing the research I was working on. And that just struck me that he was just such a nice man. And so he became a very strong mentor to me to kind of guide me through the process of becoming a heart surgeon. And then the other person who had a real impact on me was a surgeon named John Cameron, who is one of the sort of fathers of the Whipple operation. He was the chief of surgery at Johns Hopkins for many years. And he was also, he had an impact because of just the way he conducted himself, his professionalism, the way he was in the operating room, how precise he was, how he never settled for less than perfection. Those types of influences, his model is really the type of surgeon that I wanted to be. So I would say those two stand out as being pretty significant mentors.
That's great experience. So once you started your career, we never think about like how big things we can achieve. Like you have achieved, those are unimaginable achievements. So at start of your career, did you thought that like my goal is to go over there, or like how was your approach when you get into the career, got into the career?
Yeah, it's interesting. I think anytime you're dealing with goals, they always evolve. I feel like you always you sort of always don't think big enough at first. At first, when I first started as a heart surgeon, my goal was just to, number one, be a good heart surgeon and have good outcomes and make sure that people trusted me with their patients. But two, be able to build a practice. And building a practice is not an easy thing, because I joined a practice where there were a lot of experienced heart surgeons. There were actually, when I joined, I was about maybe 37, 38 years old, but there were other heart surgeons that were everyone else was 55 or older. So they were experienced heart surgeons. And so I had a lot of questions of how was I going to make an impact in this environment where there were people with so much experience. And so, what I did was I focused on doing things that other people didn't do. And so to build the practice, number one, I took call all the time because people don't want to take call, especially as they get older. They don't want to work on the weekends. So I worked almost every weekend. And, at least every month, 3 out of 4 weekends, I would take my partner's calls. And the other thing that I was willing to do is I did every aortic dissection that came in. Because I feel that, I was interested in aortic surgery. I had completed an aortic fellowship. And that was, again, something that people didn't want to do. And so by doing those things that other people didn't want to do, I gained this positive reputation as the person who you could always send surgeries to, and I would always be available. And it also increased the number of touches that I had with various referrers. So, there are medical doctors and cardiologists and surgeons all over the state and all over the region where I live. And so every opportunity you have to meet one of them is another opportunity for them to send you a patient. And of course, once you build that momentum, it just grows. And I would say that throughout my career, I've always tried to think about how can I do things that other people don't do. So after I started doing so many dissections, I said, well, how do I make this dissection operation faster and better than what it normally is? And, normally dissection operation takes maybe 6 to 8 hours, and you would cool the patient down to 18 degrees or maybe moderate hypothermia, 26, 27 degrees. But I said, can we do it without cooling the patient at all? And can we do it in 2 hours? And so we crafted a way to do the aortic dissection operation where it takes about 2 to 2.5 hours, and we really don't cool the patient anymore. And with that approach, we actually have better outcomes. The patients have less, neurodegeneration. They have less bleeding. They leave the hospital quicker. I did the same thing with minimally invasive valve surgery. So, I kept, a lot of people do sternotomy, valve surgery. Some people do minimally invasive. And the minimally invasive practice didn't really exist where I was. So I said, well, I'm going to start this practice. And how can I make the minimally invasive surgery better, faster, more efficient, smaller incisions? And so everything I do is always focused on improving. And when you do that, it's sort of like a snowball effect where your everything compounds. Your reputation compounds, your experience compounds, your efficiency compounds, and all of these things happen, which just take you to that higher level.
That's great, sir. So suppose now if I'm preparing for USMLE, what should be my goals? Like, is surgery really difficult to get? I've heard about that. It's like really difficult to get into general surgery as a branch.
Yeah. Well, I think you have to have a clear vision for which specialty you want to go into. I mean, most people, by the time that they are taking USMLE 2 and 3, they really know what specialty they want to go into. Now, when you're taking the USMLE 1, you don't really know yet. So I would suggest that on the first USMLE, you just want to do absolutely as well as you possibly can. That's very hard because medical school is many, many topics. And so studying for that USMLE test is a daunting task. I actually took about 6 to 8 weeks off. I did not do a clinical rotation, and I just studied for the USMLE. That was my full job. I from 8 to 5, I didn't do anything but study. And I think that served me well because I was able to focus completely on preparation for that exam. Whereas I know a lot of my colleagues were trying to do maybe an easier clinical rotation while also studying, or they were trying to work while they were studying. I just find that's very hard. I think that the way and I believe this about everything, if you want to excel at something, you have to have total focus on it. I tell people, I call this concept rolling focus. So one of the problems that people often have in life is they try to do too many things. They want to be a great parent, and they want to, be a great spouse, and they want to do good at their job. And they also want to have, play poker with their friends, and they want to have a collection, and they want to read about this topic. And, it's very hard to do many, many things and be good at them. And so it's really best, if you want to be good at something, to pick the 2 or 3 most important things, the things that mean the most to you. So, your family is probably number one, or in that top 3. Your work is one, and then there's really only room for one other thing. But that doesn't mean that it's one thing for your whole life, because you can do what I call rolling focus, which means that, maybe you focus on that one other thing for 2 to 3 months. And then after 3 months, you focused on something else. So if you're interested in investing, you may spend 3 months learning all about investing. And then the next 3 months, you may want to learn a foreign language, or, you can kind of break it up that way. But one of the problems that people have is they try to do too many things at once. And I think, just to get back to your point about the USMLE, really total focus on the USMLE at the time that you're studying for it is very important.
Yes, sir, I agree with that. Actually, I was also one of that person who focuses on so many things. But during preparation, just like correspondent to USMLE, we have NEET PG examination in India. So before your super specialty, we have to do that examination. So at that point, I had to take off from my job for around 6 months and then prepared in that and then got the rank. So where do you see as a Indian medical standards as compared to the American?
Well, I don't know if I can comment too intelligently on the medical standards in India. My understanding is that there's very good medicine practiced in India. There's also, I think there's somewhat wide variation in the medical practice in India, where some hospitals are really outstanding hospitals and maybe some are not as good. But I don't know if I can speak too intelligently on the differences between America and India. I think that you know that much more than I do.
Yeah. Oh, all right. So no issues. So coming back to the medical things or medical hospitals, basically in USA, as we know, there is most of the times a lot of waiting for the patients because of the unavailability of the doctors and because of the scarcity of the surgeons. So have you faced the same situation? That do you have like very long wait list for your surgeries?
Yeah, it's very challenging. That's a big problem. One of the problems that happens when you become in demand and people come to see you from various places is that you do have a long wait list. And especially in heart surgery, sometimes people have, when it's a problem with your heart, you need it taken care of right away. You can't wait 8 weeks or 12 weeks for the surgery in many cases. So I find myself constantly sort of juggling the patients. So I will have the schedule marched out, but I'm constantly having to move patients who might be 2 weeks to 4 weeks to get someone in a little bit sooner. That's just the nature of it. There just is not enough highly specialized heart surgeons who do what I do to accommodate all of the patients who have heart problems.
Yes, sir. Definitely, it's demanding career, and I know that you do up to more than 700 surgeries throughout the year. So, like, how do you relax yourself after a surgery or before a surgery? How is your approach before, because it's one of the most difficult surgery, I guess,
Yeah.
because considering the involvement of the heart, you're basically holding the heart in its place and then you're doing the things in it. So it's really difficult as the physician's perspective. I just wanted to ask about that. How do you relax yourself?
Yeah, it's very hard. The thing is that's interesting is that, one of the key elements of heart surgery is resetting yourself mentally, because, you may do a surgery that may not go well. And, for whatever reason, the patient was sick or something happened that, the team didn't perform the way they should. Surgery didn't go as well as you wanted to. And then within an hour or so, you have to be ready to operate on the next person. And the next person deserves your full focus, your full attention, because, it doesn't matter what happened with the last one. That next patient needs absolute perfection, and you don't want to have a string of bad outcomes. So one of the things that you have to get good at when you're a heart surgeon is learning how to mentally reset yourself. It's sort of like, I tell people, like shooting a free throw. If you miss a free throw, you can't be thinking about the last free throw when you shoot the next one, or you're going to miss the next one also. Same thing in football. If you miss a field goal kick, you can't be thinking about the next one. So this takes practice, but you have to do something to completely clear your mind of what happened before. So, I always take some time between surgeries. I take some deep breaths. I try to totally clear my mind. I completely remove what happened in the last surgery where I was intensely focused. Even if the surgery was good, you still have to remove that from your mind and clear the mind completely to focus on the next one. And, like any type of meditative process, that takes a lot of practice. People are not really good at it initially, and I was not good at it initially, but over time you get better at it. And that's really one of the key elements for having good performance in the operating room.
That's fine. A really nice answer, actually, because many students nowadays want that amount of achievement or that amount of focus since day one, right? But gradually, as you progress throughout your practice, definitely you get that. So coming back to your work-life balance, like how you plan for your OTs and when is your OPDs?
Yeah, you mean my like vacations and holidays and things
Yeah.
like that?
Yes.
Yeah, so it's I think that it's this is work-life balance is a challenge, and I wouldn't say that I have the best work-life balance. I mean, I think one of the things that I enjoy are my additional projects that I'm doing. So I really like speaking. I really like teaching people about achievement. I like helping people go after their dreams. And I like learning about investing and things like that. So those things are fun for me. So for me, when I have time off, I like to focus on my sort of other hobbies. And for me, that provides a mental respite because I don't focus on the heart surgery during that time. I think that you have to, as a person in medicine, no matter what specialty you're in, you have to really be dedicated about setting aside time to take off. And it means looking at the calendar in advance and saying, I will take this week off. I don't care what's happening with my practice or with my partners or whatever. This week, I'm taking it off. And that just has to be non-negotiable. Because actually, I think that taking time off makes you a better physician because you come back more recharged, rejuvenated. I know every time I take time off, I have new ideas, new things I'm thinking about, because you can't turn your brain off to heart surgery. Even if you're sitting on a beach, you're still thinking about, oh man, how can I do this operation a little bit better? And I come back and I feel like I'm a better surgeon because I took the time off.
That's great, sir. That's great. Coming back to your achievements, as I know, you're the most highest volume of the aortic implant surgery you have done. So, what are your experiences? How you went into that zone about the aortic wall replacement?
I do a tremendous number of aortic valve surgery. Nowadays, a lot of patients get transcatheter aortic valve, and we do about 600 transcatheter aortic valves per year. I do about 300 of them, but I also do about somewhere between 200 and 225 open aortic valve replacements, and I do them mostly through minimally invasive thoracotomy approach. So they go through the side instead of having to open the chest. This has major advantage because it allows patients to recover quickly. They're only in the hospital for about 3 days instead of 5 with the traditional sternotomy approach. And they're probably 80% back to normal at about 2 weeks, whereas when you do it through the sternotomy approach, it's more like 80% back to normal at about a month. And so I think that that's one of the reasons that I do, I've had success doing so many aortic valve implants because this approach, which I've become well known for, is really a game changer for patients. It helps patients recover so much faster and get back to the quality of their life, which, as you know, is extremely important for patients.
Exactly. So coming back to the career development, like at what point you must have got a support from your partner. So I would like to know about that, like how you met your partner and like how things went.
So my group, when I started, I had 7 partners. Well, I was the 7th, so 6 partners and myself. And we all had sort of individual niches, specialties. I actually chose the practice because there wasn't anyone doing as much aortic surgery. And that was something that I was really specialized in. I had done additional training in that. And so for me, that was a perfect niche. They were very supportive to allow me to do aortic aneurysm cases. But like I said, particularly the emergency cases. So the elective cases, they were still doing a lot of those themselves. But by doing all of the emergencies, I got that reputation as the person who was the go-to person for aortic aneurysm surgery. And then those started coming to me. I would say that my partners were very supportive, and I could always go to them if I had a question or a problem. In terms of building the practice, I had to do a lot of that on my own. I mean, that was a lot of meeting people, making connections, like I said, taking extra call, and doing the complex surgeries that other people didn't want to do. That's what really enabled me to build the practice.
I know about your innovative approach throughout your practice. So, what is the most impactful innovation or improvement in the surgical procedure you have done, according to you, will create maximum impact throughout the future?
I'm really proud of the way we do circulatory rest and aortic dissection surgery. I think we have combined a lot of techniques from a lot of different places, and also created some of our own techniques in order to do those surgeries with really almost no hypothermia. As you know, traditionally when you do aortic arch surgery, because you have to interrupt the blood flow to patients' brains, you have to come up with a strategy for that. And the historical strategy has always been to cool the patient. So very similar to when a child gets stuck under the ice, but is okay. If you cool the brain to hypothermic levels, you can stop the circulation for a period of time and patients will be okay. The problem with that approach is that it always led to neurocognitive decline, seizure disorders, and issues. And so over time, we have tried to get more normothermic in our circulatory arrest protocols. And we've now gotten to the point where we're almost completely normothermic. And what I'm really proud about is that it's not just me who does the surgeries, but I've now taught this to all of my partners, other people in the state and in the region, and it's now becoming a more common way of doing the operation. So it's reproducible. So I think that's made a very big impact. I mean, that's you're talking about less blood transfusion, quicker hospitalization, quicker recovery, and faster return to quality of life. So that's one of the ones I'm very proud of. I'm also very proud of our valve program. When I started as the director of our valve program, my philosophy is that no one should ever have a sternotomy. And I said, well, what if we do it that way? What if that's our premise? That's our baseline, that no one gets a sternotomy. Now, obviously, it's unrealistic that no one will ever get a sternotomy. There are cases where you have to do it. But if you strive for that, if you make that the baseline, where you're going to try to do aortic valve replacements either this way, mitral valve this way, I can do double valve replacements through the side. I've even done triple valve replacement through the side, AVR, MVR, and tricuspid valve. And so and then of course the transcatheter program, which we have a lot of experience with, both with mitrals, tricuspids, and aortic valves. So if you have that as your baseline, that you're going to make it so that no one ever needs a sternotomy, you're going to be very impactful for a lot of patients. And so I'm a firm believer in setting your goals high, and then setting them high, and then trying to even exceed the height you set. If you set a goal at 100 times or 1,000 times what you think you're going to achieve, and if you fall short, you've still done a great thing. You have still gotten to maybe 10 times or 20 times what you thought you were going to achieve. And so that's what I do with medicine, and that's what I do in my whole life, is I try to set very high goals and I try to meet them. But even if I can't meet them, it's okay, because it's still better than it was. I mean, I think about all the patients we've helped with minimally invasive surgery, simply because we had that attitude.
Yes, sir. Coming to the students who are actually getting into the general surgery, what qualities they should be having to get into the CVTS. And I would like to know about the future of the CVTS as well. As you know, those are more of the interventional cardiology procedure are coming. So do you think that CVTS is gonna get flourished in the future?
Yeah. Do you mean in terms of cardiac surgery or also general surgery in general?
No, I mean students who are general surgeon right now. So
who are going
they
into
want to
cardiac.
perceive the CVTS. So what should be their mindset?
Yeah, I think so. I think when you're a general surgeon and you want to be a cardiac surgeon, I think you have to focus on a couple of things. Number one is, one might surprise people, and that is that you really have to have intense focus in the operating room. You have to figure out how to not distract yourself, because the heart surgery operation is very intense, and it's very intense for several hours in some cases. And at any moment, it's life and death. And so focus and the ability to focus is one of the most important aspects to being a good heart surgeon. I think probably even more important than technical ability, from that standpoint. Now, I would also focus in general surgery on trying to get as much technical skills as you can, and specifically work on the vascular surgery side of things, because learning how to use the fine needles and sew the fine vascular anastomosis is something that just simply takes practice. I mean, most people are not very good at it when they start, and so the more you can practice, the better you will become. So I think really focusing on paying attention to focusing hard on your surgeries and maintaining your concentration during the surgery and improving your vascular technical skills is important for general surgeons who want to be heart surgeons. Now, your second question about the future of the field, I think that it's obviously the future is a little bit unknown. I mean, I think that what we have seen from the past 10 to 15 years is a greater and greater emphasis on minimally invasive transcatheter approaches. So industry, as you know, is really pushing transcatheter valves. They're just going to keep getting better and better and smaller, in the same way that stenting kept getting better and better for coronary artery disease. But there will always be a need to remove those valves, and for a surgeon who knows how to do open heart surgery to replace those valves open. I mean, some of those valves are going to get infected. A lot of transcatheter valves are being put in patients who are younger, and so in the future, they may not be a candidate for transcatheter valve. Just like patients who got stents when they're younger, maybe when they get older, you can't just keep putting stents in them, and now you have to do you have to do a CABG or a bypass operation. So I think the future for heart surgery is very bright. I mean, the minimally invasive is bringing more patients to be treated. And when you have more patients being treated, you will ultimately have more surgery. I just think that the future heart surgeon is probably going to be a little bit more hybrid. They're going to have more transcatheter skills, more wire skills. And so, that's a trend that I see continuing.
Yes, sir. Just a fun round where I'll be asking you, what if not? Just an imaginary set of questions. So first is, if not surgeon, what you would be in medicine field or in other field as well?
Yeah, I think, I enjoy investing in real estate. I think if I wasn't going to be a doctor, I would probably do something in investment, maybe, either real estate developer or private equity fund manager. I do like buying businesses, particularly businesses that are undervalued. So I find that very interesting. I think that would be what I would do. In medicine, I really liked the surgical fields. There wasn't much, I liked plastic surgery also. I liked vascular surgery. Those would be my two other fields that I would do if I was in medicine.
Yes, sir. Coming to the, again, flow of the discussion, that if you want to name few of the best institutes about CVTs in USA, so which would be that?
So I think so there is institutions for training and there's institutions for being a patient. So, I think that clearly in the United States, probably the institution that has the best overall reputation is the Cleveland Clinic for being a patient, to go to that place. I mean, they have achieved incredible results over many, many years, and they, as a result, have many, many patients. There are others, and the U.S. News and World Report ranks them, and ones that are consistently at the top of the list include places like Columbia, Mayo Clinic, Johns Hopkins, some of the California programs like UCLA and Cedars-Sinai, and many others. I think that that's if you're a patient. As in the United States, as a patient, you can look at the STS rankings, the Society of Thoracic Surgeon rankings, and the highest rankings is 3 stars. I was proud to say that our hospital achieved the 3-star ranking in all 5 categories that they rank, and last year, and we were only one of 3 hospitals in the country in the United States that did that. So I think that's something that patients can look at, and they can really make the decision where they want to go based on that. Now, from a training perspective, it's a little different. Um, when you are in training, you want to go to a place that has a very rich history of allowing the trainees to participate in the operations. Some places do not have that reputation. Cleveland Clinic, for example, has the reputation, and I've never trained there, so I can't speak with personal experience, but I can only speak based on reputation. The reputation is that a lot of the surgeons do a lot of the surgeries, and so it might not be the best place to be a trainee unless you are already a very experienced surgeon that you can come in and make an impact or really gain from watching. So I think the training programs in the United States are very good. I mean, I'm biased, but I think Columbia is a wonderful training program. They really allowed me to flourish there and to participate in the operations. I think the University of Pennsylvania is a wonderful training program. I think the University of Michigan has an excellent reputation as a great training program. Duke has a reputation as a good training program. I'm trying to think of others, but those are some of the ones that come to mind as really top tier cardiac surgery training programs.
Yes. Thank you so much for that. So this is really a high-stake profession. Being a surgeon, that too handling day in and out such a critical cases. There might be possibility that you have encountered under some failures. So how do you deal with those?
Yeah, somebody asked me that the other day. Actually, they said, how do you have the courage to continue when there's something that you might be afraid of, that, for example, you may make a mistake and a person would die. How do you have the courage to do that? And I said that, being brave doesn't mean that you're not afraid. Being brave means you are afraid, but you do it anyway because it has to be done. And so I believe that that really holds true in heart surgery. I mean, there are tense moments. There are times when life is on the line, and there are times when you are going to have patients die despite your very best efforts. And it never gets easier when that happens. It's always hard, but over time you do get better, and you learn to compartmentalize, to realize that later on you're going to figure out how you get better, and then move on. I mean, I used to, I think your evolution of how you view death as a doctor changes in your training. So when you start out and you're a brand new medical student, you view death like anyone would view death, as a shock, sadness, those types of things. Then as you go into your training and you're a resident, I feel like you view death a little differently. You start thinking about, why did the death happen? What can I learn to prevent this death from happening? What was the mechanism, the pathology? And then when you get to be an experienced surgeon, I think you view death in a very different way. And that way is that you say to yourself, death is always a failure. It was in some cases a failure of us to recognize this problem early enough. It might have been a failure of the health system that failed a patient. It might have been a failure in the operating room. And so I'm always thinking about, how can I learn so that the next time we don't have a failure? What am I going to do differently so that the patient does better the next time? So I think that my view on death has evolved as I've evolved, and I think that that's the pathway for most trainees.
That's great answers, sir. Then do you like to read books? Like, what are your recommendations for the future surgeons that they should definitely go through these books for mental strength?
I do like to read. I mean, a while since I've read. I don't read too many medical books anymore. I usually get my medical knowledge from the journals and things like that. So I do think it's very important for students, I think it's important to develop a habit of reading journals. Whatever that habit is, nowadays you can have them delivered to your email, so you see the highlights. You should kind of figure out how to somewhat stay abreast of the changes that are happening in medicine, so that and that should just be part of your baseline. Maybe you do that every Monday morning, or you do that every Friday night, or whatever. That should just be kind of your baseline existence, that as you go through your life, you want to pay attention to the journals and understand. I think that I personally enjoy reading a lot of nonfiction books. Uh, I think that I like biographies. I like reading about people who have achieved great things and their mindset, learning about their mindset. So I'm reading one of Rockefeller right now, which I really enjoy, and I think that's what I like to read.
Yes, sir. Do you ever have underwent like I would say burnout? What do you think about that? Like mental burnout, you must have thought about as a surgeon. It might be
Yeah,
overwhelming most of the times. So how do you deal
yeah,
with that?
yeah. I feel that burnout. I truly feel that burnout happens when you're forced to do things that you don't love. When you are stuck doing the things that you don't want to do, that's what leads to burnout. So people burn out when they're in a menial job that doesn't have a lot of meaning to them. And I think from a medicine standpoint, people burn out because of the things that are not sort of taking care of patients, like the paperwork and the billing and all and the fighting with the insurance companies and those sort of things. I think if you frame it that way in your mind, that you're burning, you're burning out on the things that you don't. So therefore, you should focus more on the things you do care about. I've never heard of anybody burning out on something that they love. If you love operating, if you love taking care of patients, if you love rounding, if you love talking to the medical students, you're not going to burn out from doing that. You're going to burn out from the things that you don't love. And so sure, I've had frustration where I've had multiple behind on my charting, and I've got administrators that are upset with me because I've got to get done, and that leads to frustration. But I try to remember that, look, I'm only feeling burnt out because these are the things I don't want to do. When I get back to focusing on the things I do want to do, I'm going to feel much better, and that has always carried me through those times, and has helped me to avoid burnout.
Yes, sir. That's actually a learning point for so many students out there that if you love something, definitely you won't feel the burnout.
Yeah. And I
Yes,
think conversely, don't go into a field that you don't love
exactly.
because you're going to make a lot of money, or because or somebody thinks, or you should do it, or somebody's pressuring you into do it. Because if you're doing a specialty that you really don't love, you will burn out. If someone tells you should be an anesthesiologist, but you don't like anesthesia and you would have rather been a pediatrician, you should be a pediatrician because for whatever reason you picked anesthesia, you'll burn out if it's not what you love.
Yes, sir. As a cardiovascular surgeon, I know the surgeries most of the times are very lengthy, but nowadays because of minimal invasive accesses, the duration actually is coming down. So it is like one of the questions that many uh, public actually non-medicals get is like, what is the maximum amount of surgery time duration in a day you have done?
Uh, well, I usually do about 2 surgeries a day, and I have done 3 surgeries a day. My non transcatheter valves. So when we do TAVR valves, we might do as much as 9 or 10 a day sometimes. But for regular open heart surgery, it's usually about 2 to 3 a day. I would say each one takes me about maybe 3 hours, but the patient's in there a little bit longer with the setup time and with the anesthesia time. And so, and then of course, there's a lot of turnover time in heart surgery because the room, has to be cleaned. They have to change the cardiopulmonary bypass machine. All that stuff takes time. So the most we can usually get done is 2 or 3 in a day.
Yes, sir. Coming to your life, sir, like this is a lesson for all of us that how to make complete success throughout the journey we have got through. I have same question for you that throughout since your childhood, like what is one highlight that you think is made you what you are today?
Um, I think that my father was a great influence for me. He was a professor of psychology, and he always talked about the importance of mindset. I mean, really paying attention to how you think about things. I mean, my childhood may have been a little different from others because time with my dad was usually spent sort of thinking and talking about theories and how to think about things. And uh, and so his influence, the importance of academics, of intellectual curiosity, that really stuck with me. I mean, I think that I was fortunate. I had two very supportive and good parents. A lot of people, are not as lucky. And so I think, they really supported me in my academic journey. And that was something that really propelled me. I mean, my parents, they only cared about academics. If I got in trouble, we were staying out too late or we were drinking alcohol or something like that, they cared a little bit, but they didn't care that much. But if I got a B or if I got a C, they really cared. So that was what was instilled on me, that you have to always do your best from a learning standpoint and try your best on everything, not just sometimes, all the time.
Yes, sir. Most of the surgeons, or most of the CVT surgeons also they work in the minimum of the resources, right? So that in Indian term, that word we call as someone who does a jugaad. Jugaad is like a Hindi word. That means you do something, you do some type of shortcut to resolve the issues that you're facing in the surgeries or something. So what do you think that have you came across such person, or have you yourself done such a small improvement so that even if something is not available, you manage with yourself?
Yeah. I think that we don't have as much of that in the United States as you guys have in India. I mean, I have heard many stories of the sort of limitation of resources in India and how oftentimes you have to take sort of shortcuts. There are times where, particularly this happened to us a lot during COVID. So during COVID, there was problems with supply chain. We didn't have all the things that we would normally had. And so I had to improvise and come up with solutions in the operating room to make sure the patient did well despite having limited resources. However, now that we're not past that, I usually don't try to operate if we have a limited resource. If we're missing something, I will cancel the surgery or reschedule it, particularly if it's something really important, rather than try to shortcut or figure out a way around it. I think that obviously there are emergencies. And so if an emergency happens and you don't have a supply you need, you're just going to have to do the best you can under suboptimal conditions. But yeah, we don't face quite as much of that as I think you may there.
Right. Actually, in India also right now, there's good development in the medical field as such. And there's a heavy amount of the medical tourism is also coming. Patients are coming to the India because the surgery rates and everything is quite cheaper than the rest of the countries because of the easy availability of the resources. So have you came across such cases, like any of your patients or any of the cases that you know of been traveling to India for surgeries?
I haven't seen that much of it. Not in the cardiovascular space. I mean, most people here are stay local, and I think a lot of times if you have a heart problem, we generally advise people don't take really long trips, to India or foreign countries while you have a heart problem, because that I've read about people going to India for like orthopedics procedures or things, because you can sometimes save some money going to India and getting the procedure done cheaper than having it done in the United States. So I have read about that, but we don't see it as much in cardiovascular work.
Yes, yes, sir. Then coming to last segment, where I'll be asking you some questions which are for the public, most of the non-medicals. Like, what is one of the commonest misconception you came across that any non-medical person brought to you about the heart health?
Yeah, I think there's many misconceptions about heart health. I mean, I think that one of the problems that that we have nowadays is that there is so much misinformation on the internet. There are so many people who are talking about things that may be good or bad for your heart without a lot of knowledge. I mean, and I think that when you talk about heart health, you have to kind of go back to the basics. And I tell people that, health is a mindset. I believe everything is a mindset. And the way you think with your mind dictates how healthy you will be. So when you're starting out, your mindset has to be on the absolute basics. So what are the basics of achieving heart health? Well, you don't want to smoke. You don't want to drink excessive alcohol. You don't want to do illegal drugs, and you want to maintain a healthy weight. So you have to figure out how to eat fewer calories than you burn. And if you do those four things, those are the basics that will keep you healthy. Um, you know, probably 60 to 70%, maybe even more, of heart issues are genetic, and you can't do anything about those. And so the genetics comes into plays is by having a doctor, by paying attention to screenings, because you're not going to be able to do anything about your genetics. So all you can do is catch things early, right? So you have to go to a doctor, do your screenings, that sort of thing. Then if you do the four basic things that I said, don't smoke, don't drink excessive alcohol, keep your weight healthy, and don't do drugs, you've probably gotten yourself to 90% of the way there. That beyond that, once you've mastered all that stuff, you can get to the extra things, the resistance training, the, paying attention to getting vigorous cardiovascular exercise, limiting inflammatory type foods and foods that are processed and foods that are in sugar, and really honing the diet. That's kind of the advanced stuff once you've gotten the basic stuff down. But I think one of the since you asked about misconceptions, I think one of the misconceptions is that the advanced stuff is more important than the basic stuff. I mean, people talking all the time about their VO2 max and whether or not, you should, eat this type of food or don't eat peppers or whatever, all this kind of stuff, when they're neglecting the basics, which is have a doctor, take care of your body in a basic, healthy way before you get to the advanced stuff. So I think that that's the way I think about it. I think of it in mindset, and you've got the basic mindset and then the advanced mindset.
Listen, I have a few more questions.
Yeah.
One is, if you're about to meet your younger self today, what advice you would give so that even like you want to make little improvement in your lifestyle or whatever it may be?
Yeah, I think that, I think there's so many areas of advice. I think if I was thinking about health, I would tell my younger self to start lifting weights and doing resistance training earlier. I did not do that until I was a little bit later in life. And I feel like it would have been good to really build up that kind of base of muscle when I was younger. And I would have also tried to eat less sugar when I was younger, because I ate a lot of sugar, both growing up and in my residency training. So that's from a health standpoint, that's what I would tell my younger self. From a sort of achievement and mental standpoint, I probably would tell myself to relax a little bit more. I mean, I think that it's important to, I believe, number one, always go after your dreams with urgency and passion. And that's my philosophy, is to approach everything with urgency. But you also have to relax and realize that it's going to be okay, that life is going to go on, that you're going to make mistakes, and you shouldn't beat yourself up over those mistakes, because the mistakes are what allow you to learn and get better. And so I would like to tell myself to be kinder to myself when I make mistakes, because those mistakes actually made me who I was today. And I sat there beating myself up over them. So I think that would be a good lesson that I could learn.
So next question is, what legacy you want to leave behind as a surgeon and as a mentor?
Yeah, I think that as a surgeon, I want to improve operations as much as I can and pass that on to other surgeons so that it improves the care of patients overall. I mean, I think that's the best legacy you can leave. I mean, I'm not an academic. I don't work at a teaching hospital, so we do have some residents and trainees, but I'm not at where I'm really teaching people how to do basic heart surgery. But I think that my legacy that I can leave from a heart surgery standpoint is to show people, particularly surgeons that are already trained, some specialized techniques which will allow them to go to the next level. As a man, I have a broader vision for the legacy I want to leave. And that is that I really want to really show people how to achieve their own versions of success, their own dreams. I think that that there is a mindset for achievement that a lot of people, frankly, don't have and don't know about. In this world, we tend to see success a lot. Influencers show it to us, it's thrown in our face. And so it makes a lot of people feel like somehow they're deficient. Like, why me? Why can't I do this? Why don't I have this car or this plane or this house? And I think one of the problems is that those people show it to you, but they don't give you the teaching of actually how to get there. And so one of the legacies I want to leave is to actually teach people how to achieve their dreams, that it requires a mindset shift and it requires a system. If you do those things, then you can achieve anything. I mean, I've studied success and achievement in all sorts of individuals, from medical fields to the business world to acting to entertainment to any of that stuff. And a lot of the techniques are very similar. And so that's what I want to show the world. How do you achieve the impossible?
That's amazing, sir. Sir, have you came to India any point of time? At any point?
Have I come to where? I'm sorry.
Have you traveled to India?
I have never been to India. No.
Oh, I would like to host you if you're here. Do you know anything from India? Like which places you would like to see?
My partner one of my friends went there recently. I don't know much about India, to be honest. I mean, it's such a vast, huge country there. So I'm not, I don't know where I would want to go. I'd obviously like to see some of the historical landmarks and some of the major cities.
You might have heard about Taj Mahal, etc.
Yeah, exactly. Yeah.
Yes. So would like to host you any point of if you want to come, you can always. Yes.
That would be wonderful. I would love that. Thank you.
Yes, sir. Coming to the final few questions, sir. From today, like, what is your approach throughout the next period of 10 years? Like, how you want to see after 10 years to yourself?
Yeah, so I'm trying to build a business around teaching people how to succeed. So I am working on a book, and I'd like to, the book right now is with an agent. The book is called Clamp Time. It's clamp time is a time that we stop the heart in order to work on it. But clamp time can also be a metaphor for life and how you have to approach your life with urgency, in the same way that we approach the heart surgery with urgency, because the heart can only be stopped for so long before it dies. So that, I like to think of the fact that, in heart surgery, the heart is slowly dying, but in life, we're also slowly dying. And so how do you approach your life with urgency so you can achieve what you want to achieve as quickly as possible? And so I'm writing a book on that subject. I want to, I make videos on this, and, how to achieve things, and the mindset required for all types of success, whether it be in medicine, health, fitness, financial success. What mindset does it take to go from being, broke to having money? What mindset does it take to be an investor, to be a real estate investor? All of those things I think are important. And so my next 10 years, in addition to, taking my heart surgery to a higher level, I also want to kind of build this business where I show people how to succeed. I speak on this. I also do a lot of keynote speaking, like yourself. And so I'm very interested in reaching a larger audience.
Yes, sir. I'm like a miniature in front of you, sir. Definitely. I would like to definitely host you at some point in my career. If suppose I get into any institute, would love to have you as a keynote speaker.
Oh, I would love that. Yeah, I would always be love to give a keynote speech.
Yes, sir. Thank you so much. So just a final question, sir. Throughout this amazing career, who are the people you would like to thank?
Yeah. Gosh, there have been so many people who have meant so much to me. I mean, my parents, my mentors in residency training and in fellowship. I had so many people who took time to teach me heart surgery and make me the heart surgeon that I am. And I've had people who have taught me about business, who've taught me about life. And most of those people did so just because they were kind. And I asked them, can you have a cup of coffee with me and teach me about your business, teach me about real estate? So there are so many people I'm so grateful for. We are the sum of who we interact with. There's that quote by Newton that, he can only see so far because he stands on the shoulders of giants. I feel like that, that to some extent has been my life. I am better because of the people who who have trained me and who have taught me what I've known.
That's it, sir. Thank you so much for your time on this podcast. I wish to see you in person, and you're always welcome to this country. Where definitely, I hope you'll enjoy the time here if you come.
Thank you so much. I really appreciate the invitation. Very nice to meet you, and I will look forward to taking you up on that offer.
Thank you so much. Thank you so much.